Today we are here to talk about communication and ways to resolve the issues it may have. My name is Leslie Mendez and I will be the narrator for today. And this presentation was done by myself, Jacqueline Green, and Haley Thompson. Aspects of effective communication include clarity and accuracy. Nurses must communicate information clearly and accurately. Active listening. Listening and acknowledging the patient's questions and respond compassionately to them. Empathy and compassion. This helps build trust and makes the patient feel safe. Patient education. Nurses are educators and must ensure the patient understands what is being taught. Collaborative communication. Nurses must collaborate together with the rest of the healthcare team to plan care for the patient. Documentation. Ensure that you document accurately and on time to avoid issues and delays in communication. Common conflicts with communication include emotional stress. Both the nurses and patients can be under significant stress, which can hinder effective communication. Hierarchy and power dynamics. Hierarchy within the healthcare team can prevent open communication. Inadequate patient information. If patients or families don't fully understand their treatment plan, medications, or care instructions, they may feel confused or non-compliant. Other conflicts with communication include language barriers, time constraints, and cultural differences. Different cultural norms and beliefs can impact communication, styles, and expectations, leading to misunderstandings if not addressed sensitively. Misinterpretation of symptoms and needs can cause important details to be missed. This can result in incomplete assessment and inaccurate diagnosis. Inadequate patient information. If the patient can't understand what is being explained, they will not be able to follow the instructions correctly, increasing the risk of complications. Emotional and psychological distance. Communication barriers can make patients feel isolated, anxious, or misunderstood. This can lower their trust in healthcare. Increased risk of medical errors. Bad communication could result in medication administration errors. Limited understanding of consent. Obtaining informed consent is essential in healthcare, but language barriers can make it challenging for patients to be fully informed to make these decisions. Reduced efficacy and increased stress. Nurses may need extra time to find interpreters or to explain things in simpler terms, which can lead to frustration, stress, and even burnout for nursing staff. Some effective ways to overcome language barriers are through the use of professional interpreters, both in person or remote, the use of translation apps like Google Translate or Metababble to communicate essential information quickly, the use of picture boards and visual aids, and the use of translated patient education materials for medications or discharge paperwork. Limited time can prevent nurses from engaging in meaningful conversations with patients, making it harder to understand their concerns, preference, and emotional needs. Time restraints can also lead nurses to rush through instructions or explanations, which can result in misunderstandings. The nurse may also miss important verbal and nonverbal cues. Time constraints can cause stress for nurses who may feel they're not giving patients the level of care they deserve. This can lead to burnout. Patients often perceive rushed interactions as a lack of empathy or attentiveness, which can erode trust. Nurses need to communicate with other medical team members, and the interactions may be shortened if there is not enough time. Here are strategies that can help nurses manage their time more efficiently. Prioritization and delegation, using frameworks like the ABC, airway, breathing, circulation, for prioritizing patient care. Delegating appropriate tasks to ancillary staff can lessen the load. Efficient documentation. Using concise, structured language for documentation can save time while ensuring all essential information is recorded. Time management techniques. Setting a routine and setting boundaries to make sure that nurse can focus on one task fully to ensure it is done correctly. More ways include using team collaboration and communication. Patient education and empowerment helps keep them informed and more self-sufficient, overall reducing frequent calls for non-urgent assistance. Preparation and organization. This allows to set an organized routine for the day. Using technology helps to streamline documentation between devices and EHRs, saving time. Effective communication with patients of different religions is essential in nursing. as understanding and respecting patients' religious beliefs can greatly impact their care and comfort. Some key considerations include dietary laws. Some religions have dietary laws that influence food choices. For example, kosher for Jewish patients, halal for Muslim patients, vegetarianism for some Hindu patients. Nurses should be mindful of these restrictions and work with dietitians to ensure suitable meal options. Nurses can ask if the patient would like time for prayer or if they would like a chaplain or family member to join them. They may have religious symbols like a cross, rosary, or a Bible, which can provide comfort. Some may prefer specific rituals or prayers. Nurses can support these practices by creating a calm, private environment when possible. Halal food is permissible and includes any food that meets specific criteria for Islamic dietary laws. Common examples include meat from cows, sheep, chickens, and fish, providing they are slaughtered by Islamic guidelines. Fruit, vegetables, grains, and seafood, dairy and eggs from halal animals. Haram means forbidden or prohibited. It refers to anything that is explicitly forbidden by Islamic law. This includes pork and its products, animals that were not slaughtered in accordance with Islamic law, blood and carrion, the flesh of animals that died without slaughter, alcohol, and any intoxicating substances. During Ramadan, Muslims fast from sunrise to sunset. Special accommodations may be needed for these patients. Kosher refers to food that complies with Jewish diet laws, such as mammals must have split hooves and chew cud. For example, cows and sheep. Fish must have fins and scales, such as salmon and trout. A core rule of kosher is the separation of meat and dairy. Kosher meals will either be dairy-based or meat-based, but never a mix. Many Hindus follow a vegetarian diet, and their diet generally excludes meat, seafood, and poultry products of any kind. End-of-life practices. Hindu patients and families may prefer rituals such as reciting prayers or placing a special significance on cleansing the body. Some Buddhists may avoid treatments involving animal products due to the principle of non-harming, or ahimsa, mindfulness and meditation. Many Buddhists practice mindfulness and may appreciate a quiet environment for meditation. Many participate in a vegetarian diet, however, it is not enforced by Buddhism, and we must ask the patient directly. Most Jehovah's Witnesses refuse blood transfusion due to religious beliefs, even in life-threatening situations. They may accept blood alternatives or non-blood volume expanders. Respect for the patient's wishes is essential, and alternative treatments should be explored where possible. Respect for modesty and privacy. Muslim and Orthodox Jewish patients may have specific preferences for clothing coverage and gender-specific care. Always ask the patient about their comfort level with specific procedures or touch. When possible, try to assign caregivers of the same gender, especially for patients from cultures or religions that prefer it. Allow for religious garments such as headscarves, yarmulkes, or specific clothing if it does not interfere with medical care. Offer alternatives if temporary removal is required. Racism can impede communication because it creates a bias. If there is racism, you may not want to be near the patient, or you may wish bad upon them. This affects the way in which you communicate with them, as you will limit the time you spend with them and may involve speaking negatively to them. This will result in lost trust, and the patient will also begin to limit communication. Sexism can result in impaired communication, as there may be instances where your patient or coworkers may not want to take orders from the other sex. There may be instances where they do not want to even work with members of the other sex. This breaks up teamwork, which is vital in order to make healthcare work. Disabilities can make communication difficult in many ways. If a patient is hard of hearing, they will not be able to understand what you are saying to them. If they do not have the mental capacity, then they will not comprehend what you are saying. If they have dementia, they may not be able to retain the information, as they will simply forget. Mental health can also affect communication because they may be judged. A patient with addiction may not receive their medications as they can be seen as drug seekers. A patient with alcoholism may not be taken seriously and may be dismissed, and a patient with mental illness may be thought of as crazy and treated like a nuisance. Communicating with patients of different ages is also a challenge. A form of abuse is when healthcare workers side with the parent rather than the child. Communicating with a child is also harder because we have to simplify everything in terms that they will understand. Some healthcare workers may dismiss something a child says, such as a stomach ache. The effects of personal beliefs can cause many problems in healthcare, such as worsening of conditions or even death. As nurses or any healthcare worker, it is important to keep personal beliefs aside when taking care of a patient. Natural disasters can interrupt communication due to phone lines being down and all of the chaos that happens. People are frightened, and they may not be able to communicate their feelings and ideas as they normally would. There are some nurses who are biased based on a client's social status, history with alcohol or drugs, and their race, so they may not take them seriously when making claims of illness or pain. When educating a client, remember that patients are under trauma and stress, which impacts their listening even more. Communication between the nurse and the family may be broken if the nurse updates the patient when the family is not there. The nurse may also ignore the family's concern. Additionally, if the family is stressed, they may not be able to communicate correctly to the nurse. Some issues that can present between communication between nurses and doctors include sometimes the doctors do not want to take the nurse seriously. Some doctors talk down to nurses, and some doctors never answer the nurse's calls or messages till the next day. Some issues with communication between nurses and ancillary staff include poor delegation. Some nurses may also overtask the patient care tech or CNA, poor communication of task, and some nurses may talk down on the ancillary staff. Communication can be impaired if there is a lack of trust. Nursing is one of the most trusted professions, but at times, people may lose their trust in their nurses if a mistake is made. In some situations, people lose their trust in each other, which can make taking care of a patient harder. Bad communication can cause medication errors. It can cause the death of a patient if not told the right care instructions to follow, and it can cause worsening of the patient's condition. Technology also affects communication. IV pumps can now talk with the EHRs and communicate. The use of online messaging to talk to doctors or other staff allows quick and real-time communication. And the use of online medical records allows everyone to see the chart on real time. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act. It is a federal law. It helps keep patient information safe and not given without consent. HIPAA can affect communication because HIPAA helps keep patient information safe when it comes to emails, phone calls, or talking to other staff members, helping take care of the patient. What is included in HIPAA? This includes phone calls, messages to doctors or other healthcare workers, emails, medical records, and talking to other team members that are taking care of the patient. Poor communication and poor understanding can cause leaks of patient information, which can put private information on the wrong hands. What it means to break HIPAA. It can lead to a lawsuit, a loss of license, and a job. On top of that, the patient's information will be leaked. How to prevent breaking HIPAA. Make sure you are changing your passwords when needed, and make sure that your computer at work is locked. Do not talk about patients to other people who are not part of their healthcare team, and do not leave patient information in the open or unattended for everyone to access or read. There are many issues with communication, but there are equally, if not more, solutions to help reduce these issues. This includes changes in communication and addition of devices to aid in communication. Noise affects both healthcare staff and patients. It can result in alarm fatigue. They can also distract the patient from active listening. If sleep is disrupted by the alarms, it can shorten their attention span, inhibiting communication. When to use open versus closed-ended questions. Open-ended questions are used to gather lots of information. You can use those during assessments. Closed-ended questions are used to confirm or deny information. Active listening is a crucial part of communication. You make sure to always listen to the patient's concerns, answer the patient's questions, ensure that the patient is in the right environment to listen, and understand what is being said to them. It is important to know verbal signs. Listen to verbal cues that indicate questions, lack of understanding, or shows understanding. Some examples include saying, "You don't understand. This is important. You need to remember this." Knowing nonverbal signs is also important. Know to understand and comprehend the facial expressions and hand gestures and what they signify. Posture shows engagement. Therefore, make sure that they are sitting up straight and actively listening. And check to see if they're maintaining or avoiding eye contact. Medical translators should be used to ensure understanding between patient and staff or family whenever there is a language barrier. Use these instead of untrained staff translators, as they may not know medical terms, leading to misleading communication. Make sure to always follow HIPAA. You need to make sure you're speaking to approved people. If the patient is unable to make decision, speak to the power of attorney or the guardian. Make sure you are speaking to the right person to meet the patient's needs, and verify that they are part of the care team. Healthcare workers should be educated in religion. Respect religious practices by communicating about their spiritual needs, communicating about dietary needs, respecting a vow of silence, and helping them with their religious events. You want to make sure that you know whether or not the patient's culture allows for eye contact or no eye contact, if they can speak to all or just one gender, and make sure to not make assumptions. Gather the information directly from the patient instead. Time management and planning. Do not rush the patient when they are trying to communicate you. Some cultures may speak slower and others speak faster. Plan to spend enough time with the patient so they do not feel rushed and unattended to. When planning care, it is crucial to inform the patient about their plan of care and allow them to suggest things they feel they may need. And you must always educate them on the why we are doing this. The nurse should know what is allowed to be delegated and provide clear instructions to ancillary staff. The staff should utilize closed-loop communication to ensure they understand what is being said or asked of them. Better staffing can also help communication. It helps reduce stress levels, which in turn facilitates focused interactions. This ensures that communication is improved and the staff can collaborate together as a team. Allowing patients to see their own EHR or electronic health record allows them to be updated in real time and develop their questions to ask whenever their nurse or provider sees them. The use of communication devices can simplify communication. Using whiteboards can help update the patient on the most important and recent plan of care, as well as the use of table tents, which also helps better visualization of content on the board. Access to their own EHR helps them stay updated in real time. We always want to include the patient in their care as they have autonomy. Including the patient in their care allows the build of trust, and this helps improve communication as the patient is advocating for themselves. and feel comfortable to speak to you about their concerns. If the patient communicates concern or questions, us healthcare workers must find the answers and meet their needs by communicating with the right person who can fulfill the patient's needs and answer their concerns. Bedside handover report is a great way to include the patient in their care. It provides an opportunity for them to ask questions, and it builds trust and fills in gaps in communication for both the patient and the staff. Implementing standard report practices, such as using an SBAR report, helps reduce errors and improves understanding between staff. If things are kept uniform, there will be faster communication of relevant information. Multidisciplinary rounds are rounds in which the entire healthcare team taking care of a patient meets together. This allows for in-person communication between the multiple care team members in order for them to discuss the best plan of care for the patient.